There is a silence that settles over a house late at night which feels heavy and different from the quiet of the rest of the evening. It is the kind of quiet where you can hear the blood rushing in your ears or the creaking of old floorboards. And in the middle of that stillness, for millions of people over the age of 60, there is a distinct physical sensation that signals the end of sleep. It is a pressure building in the lower abdomen, a subtle urgency that grows louder and cannot be ignored until the moment you get out of bed. This is the reality of nocturia. It is the condition of waking up 2, 3, or even 5 times a night just to empty your bladder. Most people believe this is an inevitable part of getting older, something that happens to everyone eventually, and there is nothing they can do about it except manage the inconvenience. They accept it as the price of wisdom. But what if I told you that this is not a sign of failure? What if I told you that this is not just bad luck or genetics? What if I told you that this is largely a result of how you interact with water throughout the day and night? You have likely heard from friends or family that you must drink 8 glasses of water to stay healthy. You have been told that dehydration is dangerous and that staying hydrated is the key to longevity. Yet, here you are, lying awake in the dark because your body is forcing you to move against your will. Your body is telling you that the strategy you are following is broken. There is a massive disconnect between what we are taught about health and what our bodies actually need when they enter their later years. We treat the senior body the same way we treat the 20-year-old body, and that is where the problem begins. Your kidneys operate differently now. Your hormones shift differently now. Your circulation behaves differently now. Ignoring these biological shifts does not just lead to poor sleep. It leads to a slow erosion of your health. When you wake up repeatedly at night, you are fragmenting your sleep cycle. Sleep is not a single block of time. It is composed of stages. There is light sleep, deep sleep, and rapid eye movement sleep, where your brain repairs itself. Every time you wake up to walk down the dark hallway, every time you splash water on your face, you disrupt this delicate architecture. You pull yourself out of restorative states and force yourself back into a semi-alert mode. Over months and years, this fragmentation accumulates. It creates a debt of exhaustion that you pay from your energy reserves, your memory, and your mood. Many seniors report feeling foggy during the day. They forget why they walked into a room. They struggle to focus on a conversation. They feel irritable or sad without knowing why. Often, this is not depression or dementia setting in. It is simply the aftermath of 1,000 lost nights. It is cognitive decline caused by lack of restorative repair. But beyond the tiredness, there is the risk. Walking to the bathroom in the middle of the night is inherently dangerous. The floor might be cold, a rug might be twisted, lighting might be dim. Your vision adjusts slowly after waking. Your balance might be slightly off due to the grogginess known as sleep inertia. Falls are the leading cause of injury-related hospitalization for the elderly. One slip, one tumble, and a simple fracture can rob you of your independence. It can put you in a wheelchair. It can require long-term rehabilitation. If avoiding nighttime bathroom trips means avoiding falls, then fixing this issue is not just about comfort. It is about safety. It is about preserving your freedom to live your life without fear of injury in your own home. So, how do we fix this? How do we reclaim our nights? We have to stop fighting the problem and start working with the biology. We have to look at the water, not just the amount, but the timing. Not just the water itself, but what else is going on inside your legs, your heart, and your kidneys. There are invisible forces at play. There are silent mechanisms that drain your bladder without you even realizing it until the alarm rings. Today, I want to take you on a journey through these mechanisms. I want to show you the science that most doctors are too busy to explain in a 15-minute visit. I want to give you a comprehensive blueprint. A plan that goes beyond simple reminders like drink less water. A plan that involves reshaping your entire relationship with fluids, your diet, and your daily habits. By the end of this discussion, you will understand exactly why your body wakes you up and exactly what you need to change to stop it. Let us first peel back the layers of the biology involved. The human body is a masterpiece of engineering designed to run on cycles. We have circadian rhythms that tell us when to sleep and when to wake. These rhythms control everything from body temperature to hormone production. One of the most critical hormones in this equation is known as vasopressin, sometimes called antidiuretic hormone. You might not know the name, but you certainly know its function. In youth, this hormone acts like a valve. As the sun sets and you prepare for sleep, vasopressin levels rise in your bloodstream. It travels to your kidneys and sends a message. It tells them to slow down the filtration process. It tells them to hold on to the water that enters your system rather than filtering it out immediately. This allows your bladder to fill slowly and maintain a safe capacity throughout the night so you can sleep for 8 hours without interruption. It is an elegant system. It keeps you dry. It keeps you asleep. However, this system degrades over time. Studies show that by the time we reach our 60s, the production of vasopressin drops significantly. Some research suggests it can drop by half compared to when we were 35. When this hormone declines, the valve opens partially. Your kidneys continue to filter urine even while you are sleeping. They ignore the sleep signal. So even if you drink a tiny amount of liquid, it is processed rapidly by the kidneys throughout the night. This is why your bladder fills faster than it used to. You are essentially swimming upstream against a river of urine production that should have stopped flowing. This physiological change is the primary engine behind the problem. Without understanding this, you will never find the solution. If you think the problem is your bladder muscle weakens alone, you are missing the root cause. You are treating the symptom, not the driver. The driver is the hormonal signal, and the driver needs help. But hormones are only half the story. The other half is structural. Your organs are made of tissue. Tissues change over time. The bladder is a muscular sac designed to expand, but as we age, the elasticity of that muscle diminishes. It becomes stiff. Think of a rubber band that has been stretched too many times. It loses its snap. It becomes harder to stretch further. This means your bladder holds less volume than it did when you were young. It also becomes hypersensitive. Tiny amounts of urine trigger the nerve signals that scream at your brain to empty it now. You do not feel fullness coming gradually. You feel a sudden urge that demands immediate action. Combine this structural sensitivity with the hormonal overproduction of urine, and you have a recipe for disaster. Even normal daytime habits become problematic. You cannot rely on intuition anymore. You cannot rely on thirst. You need data. You need a strategy. This brings us to the first major mistake that almost everyone makes before going to sleep. It is a habit so common it seems harmless. It is the act of drinking water right before lying down. You might be thirsty. You might be taking medication that dries your mouth. You might just have the glass sitting on the nightstand because it has always been there. It looks convenient. It looks healthy. It looks like caring for yourself. But biologically, it is a trap. When you consume fluid within the last hour before sleep, you are flooding the system right when it is trying to shut down. You are adding gasoline to a fire. Even if you sleep, your kidneys are forced to wake up to deal with the load. Your bladder starts filling while you are drifting into stage 1 sleep. Then, 60 minutes later, the signal comes. Wake up. Go to the bathroom. And once you are up, it is hard to fall back asleep. The disruption has happened. The sleep debt has increased. And you have done it to yourself without realizing the cost. To fix this, you must establish a fluid boundary. This is not about stopping drinking. It is about stopping late drinking. You need to define a cutoff time, a window where the tap turns off. For most seniors, this window needs to be roughly 2 to 3 hours before bedtime. If you go to sleep at 11 o'clock, you need to finish your main intake by 8 o'clock. This gives your kidneys enough time to process the bulk of the liquid before the night cycle begins. It gives your bladder time to settle down. It allows vasopressin to do its job. Now this sounds restrictive. It sounds hard, especially if you spend your evening watching TV or reading or socializing with a partner who enjoys tea or wine. But you must view this as a trade-off. You are trading a sip of water for 4 hours of uninterrupted sleep. Is the sip worth the sleep? For most people, the answer is no. You can hydrate well without sacrificing your rest. You just need to plan ahead. Some of the worst offenders in this category are caffeine and alcohol. We often associate coffee with the morning and wine with the evening. People say a nightcap helps them sleep. Alcohol might induce sedation initially, but chemically it is a diuretic. It suppresses vasopressin production. It tells your kidneys to dump water faster. It destroys your sleep quality and increases the frequency of bathroom visits. Tea is similar. Even herbal teas contain large volumes of liquid. Chamomile tea is soothing, sure, but it is still water. Pouring a mug of warm liquid before bed is pouring water into a tank that should be emptying slower. So the rule is strict. No big fluids after dinner. If you must sip, keep it small. Enough to wet the throat, not enough to fill the bladder. This single change alone resolves the problem for a significant percentage of seniors. It proves that sometimes the most powerful medicine is not found in a prescription bottle. It is found in the discipline of routine. However, stopping water at night is only half the battle. Because if you stop drinking water at night but you also never drink water in the day, you are putting yourself at risk of severe dehydration. Dehydration thickens the blood. It strains the heart. It causes confusion. It can actually worsen bladder issues by concentrating urine and irritating the lining. You cannot solve this by restricting water globally. You must restrict it temporally. You must shift the weight. You must carry the hydration burden to the beginning of the day. This is the second vital principle. You need to drink most of your water when your body is ready to handle it. That is usually morning and early afternoon. This is the active phase of your life. Your metabolism is running hot. Your digestion is working. Your lymphatic system is flushing waste efficiently. If you drink your water when you are standing, moving, walking, talking, and engaging with the world, your kidneys can clear it efficiently. Think of your day as a bucket. During the day, the lid is off. The water flows in and the water flows out smoothly. At night, the lid comes on. The flow slows down. If you try to pour the water into the bucket at night, it overflows. If you pour the water in the morning, it is absorbed, processed, and expelled during the daylight hours when you are awake. The problem many seniors face is the reverse. They do not drink much until the evening. Why? Because they do not feel thirsty. This is another critical change in aging. Your thirst mechanism dulls. You lose the sense of alertness that screams for you to drink water. You wake up, you feel fine. You sit down, you watch TV. You feel fine. You do not realize you are already mildly dehydrated. By dinner time, you realize you have not had a proper drink in 12 hours, so you compensate. You drink a lot quickly, and boom, you have the flooding scenario again. You have to manually override your thirst signal. You must set reminders. You must train yourself to drink without waiting for the cue. Start your day with a large glass of water immediately upon waking, before coffee, before food, before checking the news on your phone. Do it instantly. It jumpstarts your metabolic rate and flushes the toxins that accumulated overnight. Follow that with a steady stream of hydration through breakfast and lunch. Aim to have the majority of your daily fluid requirement met by early afternoon. This might seem like a lot of drinking for some, but remember, you are shifting the timing. Once you pass the early evening window, taper off. Drink smaller amounts, sips only. This prevents the evening overload. I have seen stories of people who felt they were dying of thirst every morning but lived comfortably for years because they didn't know how to distribute their intake. Fix the distribution and the thirst disappears naturally because your body is not fighting the rhythm. It is finally synchronized with it. Now, let us talk about the third element. This is the most neglected aspect of the entire issue. It is the one that hides in plain sight. It involves your legs. Yes, your feet and your ankles hold secrets that dictate your bladder behavior. Throughout the day, gravity pulls fluids downward. If you sit for long periods, whether working at a desk, watching television, or resting in a chair, fluid tends to accumulate in your tissues, specifically in the lower extremities, the legs. This is known as dependent edema. You might notice it by looking at your shoes in the evening. They might feel tight, or you might press your thumb into your shin and leave a dent, or your socks might leave imprints on your skin that don't fade immediately. This is trapped fluid. It is sitting in the spaces between your cells. It is not causing you harm yet, but it is waiting for a release. What happens when you lie down to sleep? Gravity is neutralized. Your legs are elevated to the level of your heart. The hydrostatic pressure changes. The fluid that was stuck in your legs suddenly rushes back into the central circulation. It goes into your veins. It gets pumped by your heart to your lungs and then to your arteries. Eventually, it reaches your kidneys. And your kidneys, seeing this extra volume of fluid, respond instinctively. They say, "Oh, we have excess water. We need to remove it." And they turn on the taps. They create urine. So, even though you did not drink any water after dinner, you woke up needing to urinate. The fluid came from your body stores, released by gravity. This is a mechanical phenomenon. It is physics. And it is happening to you every night if you are not managing your circulation. This is why reducing sodium is crucial. Salt attracts water. It holds onto it. If you eat a meal high in sodium, your body retains more fluid in your tissues during the day than usual. More fluid stays in your legs. More fluid waits for the night. More urine gets produced at 3 o'clock in the morning. Reducing salt intake is not just about protecting your heart. High blood pressure is a concern, but preventing nocturia is another benefit. You need to read labels. Look for low-sodium options. Avoid processed foods, canned soups, deli meats, frozen dinners, and fast food. These are the hidden bomb factories of sodium. Cook from fresh ingredients. Use herbs and spices for flavor instead of salt. This reduces the retention in the legs. Less fluid to store means less fluid to dump at night. Simple chemistry. Another powerful technique to combat leg swelling is leg elevation. This is a passive therapy that costs nothing. If you have access to a recliner, great. If not, use pillows. Find a time in the late afternoon or early evening before your dinner. Spend about 30 to 45 minutes with your legs propped up, higher than your heart if possible. Ideally, lying flat with your legs on a stack of cushions works best. This mimics the position you will take at night. It encourages the fluid to drain from the legs back into the circulation while you are awake. If the fluid drains while you are awake, your kidneys can process it while you are awake. You can urinate before bed. You go to sleep with an empty bladder. You sleep through the night. If you wait until you are asleep to raise your legs, the damage is already done. The fluid moves too late. The kidneys respond too late. The bladder fills. So elevate early. Treat your legs like a reservoir that needs emptying before the night shift begins. It is important to combine all these strategies into a cohesive system. Doing just one might help. Doing two might help more. But doing all three consistently creates a transformation. Let us build a daily routine based on this knowledge. Start the morning with intention. 1 glass of water, immediately. Keep it by the bed. Get it down before anything else. Shower, eat, work, move around, walk. The movement keeps the fluid circulating. Keep drinking through the morning and early afternoon. Maybe a glass of water with lunch, a glass of water mid-afternoon. Monitor your thirst, but do not rely on it. Stick to the schedule. By 4 or 5 o'clock, switch to smaller sips. Reduce the volume. Be mindful of sodium. Check your food. Prepare meals at home. Enjoy your evening tea or coffee early, but not right before bed. Finish your last drink at least 3 hours before lights out. Elevate your legs for 30 minutes before dinner. This is the reset. This is the maintenance protocol. Now, let us address some of the hurdles you might face along the way. Some people will ask, what if I still have to go? Is there hope? It takes time for your body to adjust. Hormonal regulation does not switch overnight. It might take a few weeks for your kidneys to adapt to the new rhythm. It might take a month for your bladder muscles to relax and regain confidence. Do not get discouraged. Consistency is key. There are other factors that complicate this. Medications. Some drugs for high blood pressure are diuretics. They force water out of your body. If you take them at night, you are guaranteeing the bathroom trips. Talk to your doctor about adjusting the timing of your medications to the morning. Sleep apnea is another factor. Breathing stops at night. Pressure changes in the chest affect heart hormones. This can trigger nocturia. If you snore loudly or gasp for air, consider a sleep study. Diabetes can also cause excessive thirst and urination. Managing blood sugar is essential. If the lifestyle changes do not solve the issue completely, there might be a medical component that needs treatment, but do not assume that immediately. Try the behavioral changes first. They are low risk, high reward, and free. We must also consider the psychological aspect of this journey. Fear is a barrier. Many seniors develop a mindset of acceptance that says, I am old, I will suffer. This resignation is damaging. It lowers your spirit. It makes you depressed. It makes you give up on exercise. It makes you give up on social events because you might not have easy access to a bathroom. Solving this gives you back your agency. It gives you permission to travel, to go out for movies without calculating distances, to stay out longer without rushing home. It restores confidence. You feel lighter when you feel in control of your body. You feel better about yourself when you wake up refreshed. You smile in the morning because you slept well. This ripple effect improves everything. Relationships improve because you are less grumpy. Health improves because you are less stressed. Independence is preserved. There is a story of a man named Robert who was 72 years old. He had accepted that he would never sleep past midnight. He moved his bedroom closer to the bathroom. He kept a pail by his side. He stopped traveling with his grandchildren because he could not make the trip. He felt defeated. He came across a guide about hydration timing and decided to try it. He started drinking most of his water before noon. He cut salt. He stopped eating after 7. He sat with his legs up. Within 10 days, he went from waking up 4 times to waking up 0. He went on a cruise. He played basketball in the park the next weekend. He said it felt like he got his life back. Robert is not an anomaly. He is a statistical possibility for thousands of others. His experience validates the science. His story shows that the solution lies within the choices we make every day. So, let us recap the core pillars of this approach. Number 1, respect the circadian rhythm of your kidneys. Stop the water before bed to allow the hormonal breaks to engage. Number 2, maximize hydration during the active day. Fill your tank in the sun, not in the moon. Prevent dehydration early to avoid compensatory overdrinking late. Number 3, manage your gravitational fluid dynamics. Reduce salt intake and elevate your legs to prevent nighttime redistribution. These 3 elements form a triangle of support. One side failing weakens the whole structure. All 3 succeeding creates stability. Stability leads to sleep. Sleep leads to health. Health leads to longevity. It is vital to remember that this is not a quick fix hack. It is a lifestyle adjustment. It requires mindfulness. It requires you to listen to your body and adjust accordingly. Some days you might sweat more. You might need more fluid. You might need to drink a bit later. Adjust based on conditions, but keep the boundary. Always protect the sleeping hours. Treat the sleep period as sacred. Do not violate it with fluids. Respect the sanctity of the night. When you do this, you honor your body. You acknowledge that it has changed. You acknowledge that it needs care. You treat it like a machine that requires specific fueling schedules, and in return, it provides you with the rest you need to thrive. As we conclude, I want you to reflect on what you have learned. You have learned that waking up at night is not a disease sentence. It is a symptom of misaligned habits. You have learned that water is not the enemy. Timing is the variable. You have learned that your legs are involved in the equation. You have learned that you have the power to change this. You do not need expensive surgery. You do not need harsh chemicals. You need discipline and awareness. You need to understand the internal clock of your physiology. If you take nothing else away from this, take this. Drink early. Limit late. Reduce salt. Elevate legs. Implement these steps starting tomorrow. Do not wait until next year. Do not wait until your condition gets worse. The moment you decide to change, the healing process begins. And if you find this information helpful, please share it with someone you love. Someone who is struggling with sleep tonight. Someone who feels the frustration of the middle-of-the-night bathroom runs. Share this knowledge. Pass the torch of understanding. Help your parents, your spouse, your siblings to reclaim their nights. We owe it to our loved ones to help them age with grace. Grace includes dignity in the bathroom. Grace includes uninterrupted rest. Grace includes peace of mind. Let us build a community that understands health beyond the basics. Let us advocate for better sleep hygiene for seniors. Because sleep is the foundation of life. It is where the body rebuilds, where the mind heals, where the soul rests. Do not sacrifice this foundation to a glass of water taken at the wrong time. Fix the timing, fix the habit, fix the sleep, and watch how your life transforms when the darkness finally stays peaceful and the morning arrives refreshed. Thank you for listening. Take care of your body. It is the only place you have to live.